channel. I know during my last video I told you I would try to give you guys a weekly update of a week in my life as a nursing student, and that has not happened. Please accept my sincerest apologies. When I tell you the first month of school went by so fast, like January, just like I blinked my eyes and it was gone. But since then it was like so much information given to us, and I was like trying to, you know, stay ahead, read ahead, study. And, you know, the first semester we're taking multiple classes. So not only am I taking nursing fundamentals in the clinicals, I'm also taking pharmacology as well as the nursing math. So it was like I had a test every day in 1 week. So like trying to break down my time in studying, it was kind of tough. Like I was a little stressed out. So I really had to get in the groove, or find a schedule, I should say, for myself where, you know, outside of the classroom, okay, I study 2 hours here, take a break here, then study some more here. And, you know, I tried to do that as much as I can before I pick up my kids from school. So once they're home, it's like study time is out the window until their bedtime, which is about 8:30. So that gives me an extra hour and a half at night to study. So I kind of was focusing on that because, you know, I'm trying not to fail. Like, especially feel anything like right in the beginning. But I'm glad to tell you guys I did pass my first exam in my nursing fundamentals. I passed my nursing math, and the clinical's not so much as testing, but we did have to do a demo return of, you know, the first 2 weeks of school. You know, there was techniques that they taught us as far as the head to toe assessment, how to properly do those, how to listen into the lung sounds, as well as, you know, checking pulses, making sure, you know, you check your vision, head to toe, range of motion. You know, like everything that they taught us in a 2-week span, the return demo is pretty much us showing our teacher what we learned before we started our hospital rotations, to know that, you know, we were prepared to do those on actual humans, because at the hospital we're each assigned a patient that we're responsible for that entire day. So that was an experience. So I passed that on the first try, thank God. But it has been a very awesome experience. When I tell you guys, going to the hospitals I've been to the hospital twice so far. So we're on the clinical floor at our hospital that we are. So most of the patients are, you know, like either cancer or hematology patients, you know, patients with blood disorders. And last week, you know, I believe it was God aligned, the patient that I was assigned to. She was such a blessing. Like she was a sickle cell anemia patient, but when I tell you she had a word for me, she had a word for me, so wise, so much wisdom. So it's just a different experience to go in the hospital, you know, to build a rapport with your patient. And, you know, as a nurse, you're your patient's advocate. So like whatever she needed, I made sure, you know, hey nurse, my patient needs this XYZ. But not only that, like, although we're assigned to one patient, you know, between, you know, doing physical assessments, vital signs every 4 hours on our patients, you know, we're allowed to follow the nurses around, and, you know, we'll monitor her as she checks on her other patients. So I got to watch, you know, her do wound care, bandage changes. I got to see a couple patients get x-rays done, CT scans. I didn't know they actually do that in the patient's room. I thought they took them downstairs to radiology, but certain diagnostic tests can actually be done in the patient's room. So I was able to witness some of those, which was very awesome. You know, and the fundamentals of nursing, you're not allowed to do anything until it's taught in your classroom and you're signed off by your professor of approval to do something. So outside of the head to toe assessment and vital signs, we aren't signed off to do anything yet. But I was blessed to have the same nurse 2 weeks in a row where she allowed me to watch. I didn't do anything I was supposed to, but she allowed me to watch a lot. You know, she taught me how she does her nurses notes and her care plans, because we also have to do care plans for the patients that we're assigned to for that day. So that is awesome. But aside from that, I actually just took my second exam for fundamentals. I didn't do so well on that one, but I knew it was because I didn't study the way that I should have. Like, I kind of took a break from study because it was like a 2-week span between our classes, our exams, and it was a lot of information. Like, you know, I didn't study as hard. I'm not even gonna make no excuses for it. I didn't study as hard as I did for the first one. I didn't do bad or terrible, but I didn't score as well as I know I have the potential to. So I do believe that reading ahead, you know, at least reading a couple pages or a day does help. Like, it really does help. Like, everyone's study technique is different and how you retain information is different. So I'm still trying to figure out what's better for me. You know, like, I'm not a type of person who can do all-nighters and cram and then be able to pass the test. Like, so it's so many chapters, like 4 or 5, maybe 6 chapters in a session that you have to learn and study and know within like maybe 2 weeks, because this session here is like 6 weeks and there's 3 exams, so like they're all 2 weeks apart. So trying to figure out how I'm going to retain all this information, read all of this, which is kind of impossible. I reverted to YouTube, watching YouTube videos. I'm learning, guys, and I promise, like, I'm going to figure it out, like, because failure is not an option, guys. Failure is not an option for us. Nursing school is hard, but failing is not an option for us. We're going to keep going. We're going to keep on persevering. You know, we're resilient, and we're going to do this. But I want you guys to know that I'm actually getting ready to take my finals in about a week and a half, so I'm going to be studying for that. But after that, there's a second stage to our nursing fundamentals process too, where we will be learning injections, giving IVs, and we'll be allowed to give medication. So I'm actually excited about that also. But I will definitely keep you guys posted. I would definitely post more often. I promise you. Like, I'm getting a hang of my study techniques and how to break down my time. Like, when everyone was saying time management is a key in nursing school, use your time wisely, get a planner, plan out your day, plan out your week. I see what they meant in the seriousness of that. Like, I really do see and understand the importance of time management in nursing school, the importance of time management when it comes to studying, when it comes to doing your homeworks, and like breaking down the necessary time to give to each class, because you don't want to put too much focus on just one class and then, you know, other materials is being shut out of your brain because you're just putting focus on just one. But I have gotten me a planner. I am breaking down my time more wisely, and we're going to ace this final that's coming up. I believe my finals is on the 25th, but I promise you, I swear on my heart, guys, I will keep you guys posted. The day of the finals, I will post a video and let you know how I felt. And if she posts grades early, I would definitely keep you guys up to date on that, because we're taking this journey together. This process is not just about me. It's about all of us future nurses, all of our nursing students, all of my family and loved ones, all these YouTube family that I have now created and gained, well, not created, but that I've gained through this experience, that's been supporting me, that's been messaging me. I appreciate you all. I will definitely let you guys know. But during I think next week I go to the hospital on Tuesday, and I will record, even if I have to make small clips and post it. I promise to do better with posting videos more often, guys. I promise you. But I just want to thank you guys for the support. Thank you for the prayers. Thank you for the messages. Thank you for liking and sharing my videos. And just thank you for taking this journey with me. And the support that I've received, it's definitely been a blessing and very much needed.